And so when do you need a sinus lift? Let's create some clarity. Let's clarify when. So you need a sinus lift for a molar when the ridge height is less than 8 millimeters. For a premolar, you need a sinus lift when the ridge height is less than 10 millimeters. And I'm going to explain. I know that the numbers here are a little bit on the dogmatic side, and I'm just giving you the rule the way it is, because I'm taking out the exception to the rule. I'm taking out the odd case where a patient never wanted the sinus lift and I went with the short implant. Pardon me. But in general, for a molar, you need to have a ridge height of at least 8 millimeters to place an implant. Got less, you need a sinus lift. For a premolar, you need to have at least 10. You got less, you need a sinus lift. The width is important as well. It's not just the height, because for a molar, we're going to be placing a 5 millimeter diameter or 6 millimeter diameter. We can go a little bit shorter on the height. For a premolar, for most patients and for most cases, it's going to be a regular platform. So a 10 millimeter minimum depth length is critical. Now, where we get confused very often is in two-dimensional measurements, or even on a panorex, which is a two-dimensional radiograph. It's not accurate, it's misleading. You need to look at the three-dimensional, you need to look at the cross-section, and I'm going to share with you the exact anatomy and share with you what you're looking at in a very simple way. Actually, going to simplify it for you. Very often, the lowest part of the sinus is hidden on a PA, on a periapical radiograph. The lowest part of the sinus is right in the middle of the ridge for a lot of cases. So you're thinking you have a lot of bone, what you're actually looking at the buccal part of the ridge. You're not seeing the middle part of the ridge. So that's important to be aware of. So when you plan your implants, if you have, for a molar, we're seeing right here at least 8 millimeters of height, which we are borderline, and we have enough width, then we need to do a minor sinus lift. And this is a great case to start. Take a look at it again. We have a ridge height of about 6 millimeters. We need to do a minor sinus lift. This is one of the great cases to start because you have enough width. You don't have to worry about that. You have an ability to anchor to the sinus floor. Plus, the lifting is going to be minimal. Plus, the membrane is also pretty thick. Here's another case that is great to start with, where the membrane is actually 4 or 5 times thicker than the norm. It's almost 4 millimeters in thickness. The chances of you perforating are very low. Even if the ridge is only 4 or 5, you can easily lift this ridge to 8 millimeters and get your 5x8 molar implant in there. So this is another great case to start. A little bit less bone, but more membrane. And then when you get a little bit more comfortable, let's say you do a few sinus lifts, you can start dealing with ridges that have about 5-6 millimeters of bone, and the membrane is not as thick. It's visible. So make sure to get at least 4 or 5 lifts before tackling this one. And in our advanced training programs, I review your cases before you actually do them. And I can let you know which one is the one you want to get started with, which ones you want to do later. And I create a customized roadmap for you. So the first rule in the posterior maxilla, you want to anchor your implants in the sinus floor with a minimal sinus lift. Anchoring into the sinus floor is critical for the stability of the implants. The sinus floor is pure cortical bone. It's strong. It'll add to your stability, and the increased stability upon placement is going to increase the success rate. Okay, so make sure that you have a good understanding of what implant you're trying to place. I gave you the 2 basic rules for a premolar and for a molar. So even if you have enough bone to anchor to place an implant, and in this case we have about 8 to 10, try to aim to anchor to the sinus floor for additional stability, even if you have enough critical. So Again, to repeat, we need a sinus lift for molars if the ridge height is less than 8 millimeters and for a premolar less than 10 millimeters.